Setting up the laptop, I know that we need a vacuum machine for the removal of the nucleus, because all other steps can be done without the vacuum machine through the small incision. So the incision size was reduced because we could remove the nucleus through a very small incision. So this course is basically managing the nucleus in a different case scenarios. So first is that some of the basics I will like to highlight before we go on to that. And these are the topics we are going to cover: the basics of nucleotomy, soft cataract, posterior polar cataract, hard cataract, wine to intumescent cataract, nucleus management in presence of a small pupil, nucleus management in presence of corneal opacity, subluxated cataract, and in presence of PCR. So some anatomical facts we need to understand while we remove the nucleus. We need to understand something about the machine and a chopper and certain nucleus removal techniques. So basics are the same irrespective of the situation. So parameter settings and how difficult the nucleus is going to be removal, that depends upon the type of the cornea you have got, anterior chamber depth, how is the pupil and iris, how strong are the granules, and how hard is the nucleus. So all these things make difference in your parameter setting. Then also parameter setting will depend upon your type of the vacuum machine, experience you have, and the techniques you are going to use. So all these things do make a difference in your parameter setting. So you need to set up parameters according to the situation. In nucleus anatomy, we need to understand that as the nucleus keep on becoming harder and harder, it keeps on becoming concave backwards. So if you make a horizontal trench straight, the hardest part of the nucleus will not be able to break. So you have got to make a trench according to the shape of the nucleus. And all other aspiration, chopping, everything you should try to perform in a central safe zone. That means you bury the nucleus, lollipop the nucleus, chop it, bring it to the center, because this is here maximum space is available for aspiration. Then aspirate there. So no procedure should be done on a peripheral unsafe zone. That means closer to the iris or closer to the posterior capsule. So this remains the basic for irrespective of the type of the nucleus you are going to handle. Now we know that these are the things which are there in the machine, and these are the tips which are available. Now mostly we use 30-degree tip, and settings will depend upon the type of the machine. Very important thing is the holding power of the nucleus depends upon the bore size of the tip. That means the force is power into the area. So when you use a smaller bore tip and a larger bore tip, actually holding power may increase by 3 times. So whenever you are into a tough case scenario, hard cataract, you need to have bigger bore. So that remains the basic. And flow rate decides how fast the things are going to happen. How strongly you will hold will depend upon a vacuum.